All right. Good afternoon, everyone. Happy Friday. We are really happy to see so many folks who are interested in joining us on this end of the week afternoon to talk about a very important topic. And I will just jump right into it because we have a lot to share, and also we want to have an opportunity to hear from you all about questions that you might have. So we will go ahead and jump into things. I'm going to run over a few logistics just to give you a tour. It's mainly about how to ask questions. And then we'll do some introductions. We'll be having a panel discussion. You're welcome to pop your questions into the Q&A box as we are discussing. We may get to some of them while we're having our discussion. And then we'll also try and save some time at the end to cover more of the questions that you all have. But like I said, feel free to pop them in as they come to you so that you don't forget them. And then we'll ask you to stick around a little bit to share some feedback about the webinar. So please, if you have time, make sure to join us to the end so we can hear your feedback. So I'll start off with my own introduction. I'm Brandon Stratford, and I'm the Deputy Director of Education Research at Child Trends. This topic is near and dear to my heart because I used to be an elementary school teacher and then I was a school social worker. So it really touches home for me, and I'm happy that it is so important to so many of you as well. So for those of you who are not familiar with Child Trends, we've been around since 1979, and we are a research organization that focuses on children and youth. We cover the gamut from early childhood all the way through emerging adulthood, and we look at a number of different sectors, but our focus really is on doing research that can be impactful and that can answer questions about the real world and help people who are out in the real world, like all of you, do your jobs better. So hopefully we will achieve that goal today. So really quickly, you should have a little kind of control panel, and that's where you'll go to enter your questions. You can see on this slide, you just go to the question and enter it, and everybody will be muted. We can't unmute the line, so that question box really is your way to ask questions. And then we'll send out an email. I believe it'll come on Monday with the slides. So anybody who pre-registered, we'll send that out to you. The slides will be available. So really quickly, before I introduce our panelists, I just want to point out that staff wellness, while I think we all agree it's a really important part of schools, and that we're going to discuss the role that schools and school mental health particularly can play in staff wellness, it's unfortunately not been as big a topic when it comes to state policies related to schools and education. So you can see here that Child Trends, with funding from the Robert Wood Johnson Foundation and in partnership with NASB, the National Association of State Boards of Education, did a review of policies and found that staff wellness, this is up through the 2017-2018 school year, staff wellness was not addressed in very many policies at the state level. That's not to say that it's not addressed at the school district level, but when we're talking about the attention that it has received from state policymakers, it's really a gap. We are actually redoing or refreshing this analysis, so look for that towards the end of January. Definitely check out NASB's website because we will be updating it with more current information. But again, this is current up to 2 years ago. And hopefully we'll see some improvements in this and additional attention. But with that kind of framing and background, I do want to jump into hearing from our panelists because we have a really excellent set of panelists today who are really experts in the field, and I want to make sure that we have the opportunity to get their perspective on things. So we'll start off with Dr. Kathleen Ethier, who is the Director of the CDC's Division of Adolescent and School Health. And I will let her introduce herself and talk a little bit more about DASH.
Great, thank you so much for having me. As Brandon said, I'm Kathleen Ethier. I'm the Director of the Division of Adolescent and School Health here at CDC. we are focused in a variety of ways that include both student and I think staff mental health as well, in that we, our vision is really around a future, as you can see here, a future where all youth will be equipped with the knowledge, skills, and resources for a healthy adolescence and adulthood. And I think, that includes their physical as well as their mental health. And we understand that, the staff and teachers, everyone who all of the adults in schools play an incredibly important role in that. One of the really key areas that we're focused on is school connectedness. And so, and really school connectedness is about the relationship between students and the adults in their school, and providing both students and staff with the resources that they need to be able to have youth feel supported and safe, and that the people in their schools care about them, are focused on their well-being and focused on their futures. And so I think it's just, in order to have healthy students, we have to have a healthy school environment. And so we really are focused on creating healthy school environments. I'll stop there for now because I know we're going to have a lot more conversation about this, but really happy to be here and glad that there are so many people who are also as interested as we are in school wellness.
Great. And I also just want to echo Dr. Ethier's point about talking about the adults in the school, because we've been intentional about not just talking about teachers. We really recognize that school staff goes beyond class, and everybody's wellness is important to be included in this discussion. So we'll move along to Dr. Hoover, who is the co-director of the National Center for School Mental Health.
Thank you so much, Brandon. Happy to be here today. As Brandon said, I have the privilege of co-directing the National Center for School Mental Health, and also recently became the director of a new center, the National Center for Safe Supportive Schools, which is now a part of the National Child Traumatic Stress Network. And I'm a professor in our Division of Child and Adolescent Psychiatry at the University of Maryland School of Medicine. And you can see here a little bit about the two centers I mentioned. Both of them are deep into the work of school mental health that we'll be talking about today. The National Center for School Mental Health has been around for 25 years now, and we're funded by the Health Resources and Services Administration of HHS. And as you can see here, our mission is to strengthen policies and programs in school mental health to improve learning and promote success for America's youth. And you can find out a bit more about what we do at schoolmentalhealth.org. We have our hands in research, training, policy, and practice to help advance the work. And then the newly funded center, as I mentioned, is part of the SAMHSA-funded National Child Traumatic Stress Network. And the work of this center really will lie at the intersection of comprehensive school mental health systems, as well as trauma-informed policies and practices, and cultural responsiveness and equity. And we've just launched our new website at ncs3.org. That's a little bit about my role. Thanks, Brandon.
All right, thank you. And we are going to move on to our final panelist, Dr. Olga Acosta-Price. She is director of the Center for Health and Healthcare in Schools, and I think she's having some camera issues, so we may not see her, but on the line. So, Dr. Price.
Hi there. Hope you can hear me. Yes. Okay. So good to join you. Happy Friday. And so I'm sorry that I can't figure out my technical issues, but as Brandon said, I am the director of the Center for Health and Healthcare in Schools, which is housed in the Milken Institute School of Public Health at GW in DC. I'm an associate professor in the Department of Prevention and Community Health. And our center has also been around for quite a while. For those who may know our founding director, Dr. Julia Lear, was a real pioneer in the sort of establishment of kind of school health programs and practices, and particularly school adolescent health programs and school-based health centers. And the center has evolved and has had the honor of working with a number of different districts, states, funders, and communities. And we really try to focus a lot of our work on thinking about the social and environmental factors that impact young people's success in schools, and taking a multi-level approach to interventions, as well as that at the core of a lot of what we do is understanding how best to collaborate with essential and key partners. So much of our work is through the lens of how communities, districts, states partner in order to advance effective school-connected initiatives for students' health and well-being. And although it is cut off a little bit, the website is healthinschools.org. So we welcome your visit to the website. Thanks.
Great. So I will put our slide back to Dr. Price so she can join us. And we're going to get started with some questions. And I am, again, really excited to have the panelists that we have to be able to talk about this, because we want to kind of frame this discussion about staff wellness within a broader discussion about school mental health and the role that schools can play in supporting mental health, as well as kind of what we're seeing as we've been experiencing this pandemic and what lessons people might be taking from that. So Dr. Hoover, I'd like to start with you and just ask you, what do you see as the role of schools when it comes to addressing mental health?
Okay, well, I first want to start by kind of how we think about or define school mental health. We've talked over the years about the misunderstanding that school mental health means kind of only tier 3 supports, or a mental health provider coming in and providing supports to students who've been identified with mental health challenges or mental illness. And certainly that may fall under the umbrella, but comprehensive school mental health systems, as they're often termed now, really is this full continuum of supports. And so when we think about what is the role of schools in supporting people's mental health, it really is that full continuum of supports, all the way from mental health promotion to identifying and supporting young people who are experiencing adversity or distress. We know in the context of the pandemic in particular, schools have served as a hub for youth and families, not only in terms of meal services, health supports, academics, but also in terms of their social emotional supports. Again, it hasn't really just been, oh, now schools have shut down and so they can't access mental health supports as they would have in the school. Schools really have become, in many ways, the default mental health support system for our young people. And we've also seen that schools have been a conduit for some of our community behavioral health partners who, at the onset of the global pandemic, really lost contact with a lot of families. And so schools have been this natural venue for our community behavioral health providers. The last thing I'll say before, I want to hear from our other panelists as far as the role of schools right now. Schools in many ways have been this incredible source of mental health promotion and identification during the pandemic. So we're hearing from schools all the time, that they recognize that young people are experiencing greater distress and new traumas, greater trauma and adversity, and they recognize their role, at least their partial role, in identifying and supporting students. So schools are working to equip their educators and student instructional support staff with, unique ways to identify students, whether it's installing new universal screening practices or, equipping educators with kind of ways to do well-being checks, either through distance technology or now for those who are returning to school. So I'll pause there.
Great, thanks. Actually, one quick follow-up question would be, would you mind just running through a little bit for folks who aren't familiar with MTSS or the kind of tiered approach? What are the 3 tiers?
Yeah. And, not everybody uses a three-tiered model, I should say that, but I think many of us do think in terms of this three-tiered, multi-tiered system of support, or MTSS. There are different frameworks out there, but essentially the idea is that if you think of it like a triangle, and many of us eat, sleep, and breathe triangles these days, the foundation of the triangle, or what many call tier 1, really is universal mental health promotion. So the idea that mental health supports are provided for all students in a school building, and not just students. And I know today we'll talk about adults as well, but really, what are the mental health supports to create a mentally healthy school? And that would include mental health supports for the educators and other adults in the building. Tier 2, working our way up the triangle, many folks describe this tier as the services and supports that are provided for young people or those who are experiencing mental health concerns or adversity or stress that's causing mild impairment, or they may be at risk for developing mental health concerns. Tier 3, working our way to the top of the triangle, are those services that are provided for young people who have an identified mental health concern, usually a concern that is significantly impairing their ability to function in one or more places, whether it's at school, at home, or in the community.
Great, thanks. So Dr. Ethier, I'd actually love to hear your perspective, and I do also want to recognize that DASH and the CDC really have been a premier champion of school health and school mental health. The YRBS, for example, gets relied on by so many folks to understand what's happening, and the promotion of the whole child WISC model. So I'd love to hear from you your thoughts on kind of what is the role of schools in mental health and during this pandemic.
Well, I think, thank you so much. And I think, I think the three-tiered model really captures nicely kind of how to think about the needs in schools. And so I would say that we sit really in those first two categories primarily, although, as you mentioned, we play a really important role in kind of documenting what's happening among youth across the country, but also in state and local education agencies. So we do conduct the Youth Risk Behavior Survey. We have, we don't have a deep bench on that survey in terms of mental health questions. We include one question that we've been tracking now for a while that combines kind of two depressive symptom questions. And so we ask students if they have felt so sad and hopeless for at least 2 weeks in the past year that they were unable to do their regular activities. So for those of you who work in this area, you'll notice that those are two questions kind of combined together that are used quite often to understand the degree to which people are experiencing depressive symptoms. And we've been tracking over time, and we've noticed that measure has increased really significantly over the last 10 years, and that has really sparked us to need to do more in the districts that we fund. So we fund local education agencies to do a combination of health education, connecting youth to services, and as I mentioned at the beginning, working on creating safe and supportive environments. And so all three of those tap into the needs around creating positive mental health in schools. So, health education provides an opportunity to provide knowledge and understanding of what mental health is. Connecting youth to needed services gets at that tier 2. So youth who are having issues, who need to be connected to either in school or in community mental health services, it provides that opportunity. And then, really getting at those protective factors around school connectedness. We particularly focus on some interventions that promote school connectedness that are geared toward LGBTQ youth, who we know from our surveys and our research are particularly at risk. And so we fund our school districts to do a whole host of activities at the middle and high school level around improving connectedness for that reason. And so we are able, through those programs, to have an impact on a wide variety of outcomes, including sexual behavior, substance use, violence, victimization, mental health, and suicide. And so, and I think what that really demonstrates is that schools can play a role, not just in, trying to identify students or connect them to services, but really at that very basic level of promoting mental health and doing that early prevention. We're also really, we were lucky enough to get some CARES Act funds to supplement the local education agencies that we fund to really focus on mental health, both virtually and for the districts where students are coming in who've spent a good period of time now out of school, and the trauma that comes with that and all of what they've been missing for those months. And so we realized that a couple things. One, that some of these activities need to move to virtual. And so how do you help a district adapt so that they are able to maintain and move forward with the things that students need? And I think back to Dr. Hoover's point, becoming this hub for how students are and staff are able to both promote positive mental health, but also to serve kids who are having issues. And then also to expand our understanding and our ability to implement social and emotional learning at earlier ages, so that we're able, we primarily focus on middle and high school, but we realize that the roots of positive mental health really start so much earlier. So we've been really trying to move into the space around how do we provide educational environments for students that teach them how to engage effectively, how to understand their emotions, how to ask for help when they need it, and all of the things that go into social and emotional learning programs. I will stop there because I do want to hear from Dr. Price, but this is really important work, and I think a place that we're going to have to spend a great deal more time.
Great, thank you. And actually, this is great timing, Dr. Price, because we just got a question from the audience. And I know that you'll be one of our best folks to answer this question, which is, could you please talk about the role of school-based health centers in promoting students' mental health, and where can we find information about that?
Absolutely. So I'd be happy to try to address that. So I'll start with the latter part of that question. One of the best places, I think, to find real comprehensive information on school-based health centers is the School-Based Health Alliance website, which really is the national center that has a repository of practice information, of research compiled, of guidance, of a lot of information around advocacy. So School-Based Health for All, SBH for All, I believe, .org, but you can maybe, yes, there we go. It's in the chat box. So for those who are less familiar, school-based health centers essentially operate as a kind of a pediatric health center, or that is actually often co-located or linked to a school, K-12 school, or to a set of schools, where they provide a kind of a more comprehensive set of health services and preventive services for young people. And the model has really evolved over the years, probably since the 80s, I believe, when the model really developed, 1980s. And so we do see, a variation of depending on the communities, depending on the resources available, the partnerships. But in essence, what we might consider the gold standard or the gold model of school-based health centers is one in which you're really able to bring together multidisciplinary or interdisciplinary professionals to work together. And that includes not just physical health providers, maybe a nurse practitioner or a pediatric provider, but also some folks to address oral health, whether a pediatric dentist or a dental hygienist, those who can also address vision care and again, a number of preventive services, and then certainly behavioral health care. And again, the ways that those providers come together can look different, and it can be that those providers are hired by different organizations who then contractually kind of come together as a team and then form a team in the schools, or they could all be from the same agency, and some can be from the school district themselves or from the local departments of health. So again, there are a lot of variations to that, but the idea that we're bringing together interdisciplinary professionals to work together to really both address preventive kind of well care as well as acute and chronic care. And I'm happy to have the panelists kind of add to that if I've missed some of the key essential features. I do think Dr. Hoover and Dr. Ethier kind of really hit some of the more important, I think most important sort of highlights of, you know, the importance of addressing behavioral health and promoting behavioral health in schools. I might just highlight a couple things. One is that I think that particularly one of the benefits of thinking about a model like MTSS and multi-tiered system of supports or any tiered supports is that it really allows for a way to integrate behavioral health into the structures and the processes that already exist in schools. So it really lends itself to integrating kind of academic and kind of behavioral and social emotional sort of interventions together, so that if they don't need to function or be treated as sort of separate, siloed, or kind of fragmented services, the idea, I think we would probably all agree and is consistent with kind of the school health frameworks and the WISC model, is that it really is about trying to have coordinated and collaborative kind of approach. And that includes, again, with all the processes that schools are very familiar with, you know, a process of school teaming, a process of screening and identification of need, a process of tailoring supports to individual child needs. And a lot of those same principles and even processes very much can apply and do apply to behavioral health. It's just about sort of broadening the teams. And again, many of those professionals already exist within schools and school environments, but often these models and the real intentional focus on behavioral health allow schools to think about how to improve their capacity and build partnerships with others. I think the last thing I'll say around that is focusing on mental health in schools really offers an opportunity, again, to be very intentional about reducing stigma related to behavioral health. I think that, again, there are many benefits we know about addressing behavioral health, mental health in schools, as well as promoting mental health in schools. And one of them many of them have to do with greater access to qualified and integrated providers and services. But the other, as I said, is around really making it, normalizing this conversation about the importance of our mental well-being as, again, a part of the whole child, but as the whole individual, because as you've already alluded to and talked about, this movement is not only about thinking about the benefits to the child and the student, and then to their families, but also to the other adults in the building. You know, it's always, I think, a benefit to be able to make it easier, validate, and to normalize that it's okay to talk about needing care or improving our supports as an essential part of health and well-being.
Thanks. So I'm going to ask actually a follow-up question from the audience again, which is actually something that I was thinking of myself, because I know that part of what came about when school-based health centers were starting was this recognition that a lot of the visits were related to mental health, and really it kind of clarified for folks that that is a big need and that schools can be a great place for access. So this question is, can you explain more about the role of the school nurse in supporting mental health, given that so many office visits to the nurse are related to mental health concerns, and kind of what that multidisciplinary team collaboration can look like?
So I can jump in. quickly, I'll just quickly say, we've worked for many years now with the National Association of School Nurses related to this intersection of school nursing and mental health. In fact, we co-developed a training, both an in-person training and an online training and implementation support system for school nurses in enhancing their mental health competencies, just recognizing, as you just said, and as the audience member mentioned, that it's actually, much of the data would suggest it's over half of visits to school nurses have an underlying mental health need or concern that is brought up. And so that training is freely available through NASN and through our National Center for School Mental Health. It's called the Mental Health Training for Health Providers in Schools. But, just speaking to your question specifically, Brandon, school nurses are essential frontline providers of mental health supports. Often in schools, they are the health provider and the only health provider, especially I would say in some of our rural and frontier communities who may even have limited access to school nurses. They may be the health provider and there may be very limited access to school psychologists, school social workers, school counselors, or community behavioral health providers. And so they have to be at the table. Even if you have a full array of other mental health providers, oftentimes the entry point for our young people will be the school nurse. They're in a good position to do not only mental health promotion with our young people, but also to help identify them and support them if they need some additional support. There was a wonderful letter that just was released from NASN to the new incoming federal administration that spoke to the importance of school nurses in the context of COVID, and it spoke specifically to their role in supporting mental health. I'll stick a link to that letter in the chat box to be shared.
Great. So we have two other meaty topics that we want to get to. So I'm going to move us along, but definitely, hopefully we'll have opportunity to continue these conversations and to add additional thoughts. I know that somebody asked from the audience about specific examples of states or school districts that are doing good work here that folks might want to highlight. So keep that in your head. But I do want to move on to one of our other really big and important topics. And I'm going to start with Dr. Ethier. So we've seen evidence that the health and economic impacts of the pandemic are hitting Black, Latino, and Indigenous communities particularly hard. And we've also seen a lot more attention paid recently to racial justice in response to police killings of unarmed Black men and women. So what role do you see for school mental health in terms of both the short term and long term to address inequities? And what do you think needs to happen to really make that a reality? It's a big question.
Yeah, I mean, give me the easy one. Cool, we're good. I mean, I think that what we've seen here with the pandemic has highlighted the fractures and the inequities in education that have been there for a very long time. And so the communities that have the fewest educational resources, the fewest healthcare resources, are the communities that are being hardest hit by COVID and by the impacts of COVID, both in terms of the health of families, the health of communities, but also the impacts of employment, loss of housing, loss of some food insecurity. And so that highlighting those inequities, and then on top of that, a move toward social justice and racial and ethnic equity provides us the opportunity to reverse some of those inequities if we have the will and the capacity to do that. Because if we don't, all of those existing inequities will be perpetuated and will be made worse. So I think my hope is that the impacts that the pandemic has had and our acknowledgement of those impacts, and then the call for social justice from communities around the country and acknowledgement that we have to address those inequities will allow us to kind of take a systemic approach that will not only address the educational issues and the economic issues, but as a result, mental health will improve, because it's cyclical in that sense of, you have communities that are stressed, have unequal and are then experiencing, young Black men who go disproportionately into the jail and prison system, who don't have equal access to employment, so all of these things are related. And I think if we start to address them, if we have the opportunity to start to address some of those issues, we will start to address mental health. If we try to address mental health, we're not going to be able to do that without addressing some of those issues. And so understanding that they are all related, that these things coexist and impact them, impact them each other, then trying to address them systemically can only help us in the long run. I think we know that children and youth who experience adverse childhood events, for instance, which has a negative impact, which impacts their experience of trauma, which has a negative impact on their mental health. If we can start to change those issues, then we change the trajectory for them. And so I think schools are a wonderful place to start to try to address equity issues. And I hope that moving forward, we have this call to action to try to be able to do that more effectively. That's my hope.
Yeah. So I appreciate your kind of also bringing up the fact that schools are such an important piece, and obviously they're not the only piece, but we really need a collaborative effort. And I'm wondering, Dr. Hoover and Dr. Price, if you have something you'd like to add here.
I'll quickly add, just that, of course, first, there needs to be a recognition of the impact of social injustices on the well-being of our young people and families and communities. Our newest faculty member at the National Center for School Mental Health, Dr. Tiffany Beeson, specializes in cultural responsiveness and equity in the context of school mental health. And she often reminds us in the field that we really must resist the tendency to pathologize individuals who are harmed by our systems of injustice. And I think that's a real challenge to us and a call to us in terms of, how we even think about mental health screening. Instead, we really must actively work to deconstruct these dehumanizing narratives of diverse communities and focus on promoting and leveraging culture-based strengths. In our new Center for Safe Supportive Schools, one of the areas that we're learning from and really trying to infuse more into our work are current models of healing that are rooted in cultural practices. So things like healing circles, to repair the harm caused by historical trauma with Indigenous communities, or things like cultural rites of passages to support positive racial identity for youth of color. So those are just a couple of ways that we are thinking about this intersection of inequity and school mental health.
Those are great examples. And the other thing that I might add, I absolutely agree. I think part of our ability to support each other in the many ways that we are impacted by both sort of social injustice, racial bias, and structural racism and the ways they play out in schools, in our healthcare systems, is to have these conversations, is to recognize that this does exist. It is not a myth. There really are these systematic ways that groups of families and communities have been disenfranchised from education, from health, from opportunity. But having those conversations with each other are difficult. We know that. We know that because of the current environment. We know that because of how our own families maybe have handled that over Thanksgiving. These are difficult conversations to have, and they bring up a lot of feelings and emotions. And so one of the things I think also that is important is that, our various mental health and health providers that work at the intersection of education and health can really be, although we all participate and are members of our communities, we also bring a particular skill set and maybe some knowledge and experiences that hopefully can facilitate those conversations when they're very difficult. People have a lot of very legitimate questions, feelings, outrage, anger, and that sometimes has other people shut down and not sort of engage in the conversations for healing. And so I think that in, again, the kinds of skills and competencies that we bring can hopefully then be a part of the solution. We can bring those to bear in a way that we can have these healthy, albeit difficult, and they're going to be, long-term conversations. These are not things that have been created in a short space of time. And so I think it is going to require a commitment and a willingness to stick with trying these solutions, opening up conversations, and keeping a space that's sort of safe and open kind of conversations with each other.
So I think you've actually helped really open the door to our next topic, which is supporting school staff. As you've been talking about the important role that school staff also need to play in these discussions and creating these spaces, I want to kind of bring us to, there's kind of two roles that I see in terms of what needs to happen for staff in schools when we're talking about supporting them in being able to deal with mental health and mental wellness. There's kind of the personal piece of how do we support their own mental wellness, but they also have the other piece of being, equipped to be able to support the mental wellness of their students. And in fact, also a lot of this can connect with the conversation we were just having. The teachers and other staff in the building also are there to, they're experiencing the experiences of their students when it comes to racial justice and the outrage. And, so I think when we talk about mental health, we can also pull that in about how do we equip school staff to have mental health, but also to support it within students.
So I'll start us off, and so I would encourage us to always also think about the potential, the possibilities, the opportunity there is, not just to think about the kinds of the awareness we want to bring around the importance of adult health and well-being, adult self-care, and ways that we need to, again, make that a part of the expectation that paying attention to that is an essential part of really operating at your best and being the best, person in your role. But also that we think about the kind of the structures, the processes that exist in and around schools that may or may not help promote or inadvertently hinder an individual's ability to keep those behaviors going. And so, we, I think, have all hopefully seen a lot, especially since COVID, a lot of reminders to each other and to ourselves around how important self-care is. And I don't think there has been a time, at least in my lifetime, where that has been more evident than now, where we are all needing to pay attention to that. And again, because as Dr. Ethier said, the research on connectedness, really helps us, and it's very strong, it's evidence that, we really should draw on, that suggests that, adults who feel emotionally supported, who feel able to manage their own stress and in an effective way are better able then to connect with their students to create the kind of classroom environments that allow learning to happen. And so, you know, it serves those multiple purposes to both, we care about the individuals in our system, but also when they are doing better, when they feel more healthy, we are also better able to be effective. But there are also examples of schools and individual schools and districts that have not only encouraged their own staff and teachers to think about the importance of self-care, but they've tried to institutionalize practices to make that more normalized. You know, we have a school that is a tremendous public charter school here in DC, Statesman, that is this incredible innovative school that really has not only, that is focused, is very committed to the mental health of their, you know, young people, particularly their young men of color in their school. But they're doing so with a real intentional focus on the mental health of the teachers and the adults in the building. And for example, having the mental health services, treatment on site, not necessarily, you know, solely for their students, but for the adults to access. And again, a very innovative model, but one that has been shown to be very effective in their environment to reduce burnout and demoralization. To really, teachers and staff carry a lot of the kind of stress that our children are feeling, as well as their own, that come from their own experiences in their lives. So there are schools we know, and we hope to hear more examples from the audience of schools that are trying to figure out that, for example, another one is that teachers often and staff talk about the need for more planning time, particularly now where they're toggling between hybrid and in-person at times, and using new technologies and the stress of all of that, and not really having sufficient planning time to manage. And so schools and districts have looked at that, again, as a way to support their educators' mental health and well-being. What are some of those good strategies for supporting the educators to have more planning time? How would they like to use that time? You know, there's a school district in Wisconsin, Sheboygan School District, which has been a recognized and award-winning kind of employee wellness program. So that's another way that districts have really thought about the ways that they are committed to employee well-being, is through, you know, stress reduction programs and offering free services, yoga, personal training, ways that we know are very good stress reduction practices, but also figuring out how to increase the accessibility of those, and again, normalizing their districts who will give mental health days and make that a part of their employee benefits. And so there are a number of really great examples of ways that that I think we can continue to learn from each other, the strategies that are going to support kind of, you know, a sense of community, a sense of connection, and caring about kind of each individual's mental health needs. I'll stop there and see what our my panelist friends want to add to that.
If I can just glom a couple of things onto what Dr. Price just said, I think she said it so well. I am reminded all the time that when we have done, when we have promoted activities in schools to support LGBTQ kids, one of those things, we promote gay, straight, or gender and sexuality alliances, but we also support BEST programs for safe spaces where teachers identify themselves as being safe for LGBTQ kids to come to them if they need a safe person or a safe space. And while we have been, promoting those activities because we know that they're good for not only LGBTQ kids, but also all kids in the school. So all kids benefit when those environmental supports are in place. One of the things that we heard so consistently from the teachers was how those activities supported them. So the mental health of LGBTQ teachers, both in terms of being able to provide those safe spaces for youth, but also having their own identities affirmed, was really incredibly supportive and changed the school environment, not just for youth, but also for teachers. And I think we promote activities that help youth feel connected, and that's wonderful. But I think we also need to actively do the same, but also understand that connection goes both ways. And so connecting youth to the adults in a school helps adults feel connected as well. And so we should continue to support those things. The other thing, when we talk to school staff and when we talk to mental health professionals in schools, what we hear pretty consistently is we're not going to be able to mental health professional our way out of the challenges that our schools are facing. And so we really do need to focus on staff very broadly in a school, both for their own mental health and for how they all collectively support youth mental health. And I think that's really important to not overburden the very few mental health professionals who are in schools, because they are incredibly overburdened. But the more that we can create a system around them that includes the other staff in a school, that connects all of them. And then the last thing I will say is that I think we have to pay special attention to our nurses right now as frontline first responders, because they are dealing with a whole host of issues, including having to do contact tracing and family notification and screening for COVID and all of the other things that, in addition to what they are having to deal with. And so when we think about the mental health of those healthcare providers and those frontline workers who are dealing with COVID, our school nurses are doing the same. And I think we have to, try to address that in some way. And I'll stop there.
So very quickly, just like we can't mental health our way out of some of these issues, we can't self-care our way out of teacher stress and burnout, right? And so I love that the strategies that were mentioned were both self-care strategies, but also organizational strategies. To quote some of Brandon's colleagues at Child Trends, I use this quote all the time. It was in a blog post from Child Trends. It says, when we accept that an unhealthy level of stress is inherent to teaching and place the burden of stress reduction on the individual teacher, we limit our ability to improve overall school wellness. And there are ways that we can measure organizational factors that influence educator well-being, and we have to actually get those measurement systems out into the field so that schools can understand how well they're doing at implementing organizational factors that predict educator well-being. I know there's some audience questions, Brandon, so I want to pause.
I think we've gotten to a lot of them, but one that I do want to bring up because I think it's related to what we're talking about. Somebody asked about, and we only have 5 minutes, but do you think that suicide prevention training is necessary for school staff during COVID? And the reason I wanted to throw that one in is partly because I've also received pushback on other conversations with folks around training teachers related to mental health, that it feels too much, that teachers have a lot going on already, and there's some pushback about training teachers on mental health related topics. But it's also, I think, so I would just like to hear the discussion around what role does that play, both in kind of support workers in their role and help to hopefully reduce stress by equipping them, but, to just kind of allow people to have something to say when there is pushback about we shouldn't be pushing teachers to become
I think the difference between, sorry, go ahead.
Oh, no, I have a feeling we're going to say the same thing. which is, I think Sharon was going to open, and I think we're all going to say the same thing, which is that, and I've heard this in DC very much too. It's understanding what we need by suicide prevention, and that we are not asking individuals to work outside of their qualifications and roles, but actually we all have a role to play in suicide prevention. I think sometimes when others maybe have a more limited understanding of what we mean by suicide prevention, as if the assessment and diagnosis of depression or suicidality or lethality or risk is the only part of suicide prevention. And it actually is not. It is one important element of it. But the other things we've been talking about in the whole hour are actually very essential parts of suicide prevention, right? Having a very strong tier 1 universal strategy, social emotional learning curricula, having strategies where adults and young people, where kids can identify someone, at least one person who they can talk to if they feel stressed or upset. I think that there is a role for all of us to play, not for all of us to need to be clinicians. But Dr. Ethier, I'm sorry if I jumped in while you were trying to talk to, but feel free to add anything else you want to.
I think, that's exactly the point. I think I'll just add, there's also a difference between providing resources to help teachers deal with what they're seeing in the classroom versus setting up an expectation that they are supposed to become clinicians. And so we hear all the time from educators that they just wish they had more knowledge and more ability to understand what's happening with the kids in front of them, rather than us going into a school and saying, okay, now you're going to be a screener. It's your responsibility to determine the mental health of your students and then do something about it. So I think that's really, and I'll let Dr. Hoover add anything she'd like to.
I'm just going to add that there's an exciting training that will be available in the public domain in March that was funded by SAMHSA, called Classroom Wise. It's classroom wellbeing information and strategies for educators. And I think it recognizes well the appropriate role of educators in promoting student mental health and their own mental health and wellbeing, and identifying and supporting students in distress. I know we have some additional resources to share as Brandon is cueing us. And we have a minute left to share them. So
yeah, we are running out of time. I will say that we're going to send these slides out, so you will have all these resources. But maybe I'll just, if each of you just want to highlight one resource from the list of many that you want to mention as we're kind of closing here. And Dr. Ethier, we've got CDC up first.
Sure, yeah. So all of these are actually built, all of the adolescent health resources are all built off the same page. So if you go to Healthy Youth, you will find all of these things, including what works around school connectedness and all of our data. So enjoy. And then at the bottom are just some things that have been put together by CDC to address mental health related to COVID-19.
And I'll just mention that we have a free online platform called the School Health Assessment and Performance Evaluation System that aligns with the National School Mental Health Curriculum for any district school individual to go in and assess how they're doing in school mental health. And then on our school mental health site, we have lots of resources related to topics we discussed today.
And I'll just say that in our website, one of the resources that you can also get to is that we have developed with our community in DC a community of practice that really is about sort of blending both what we know to be effective practices with how we need to think about tailoring them for specific communities, and so that we make sure that we are seeing them in application and actually implemented in our schools. And so that website with the resources has been in some ways tailored and shaped and adopted and adapted by the folks in the DC community, are available as examples for anybody to share. Thank you.
And I will just share two quick examples. They are actually both linked to some of our funding from CDC, actually. So the first one up top is we have a newsletter that we send out twice a month, and it just summarizes kind of state policy related to a specific topic. Recently, the last one was on SEL, so kind of summarizing what states have been saying about SEL in their school reopening plan. So a focus on COVID and kind of the pandemic and how states are supporting schools in addressing the pandemic. And the one before that, which was 2 weeks ago, was focused on addressing trauma in schools. So if you're interested in that, you can go to this link and you can sign up to receive the newsletter, and it will come on Wednesday mornings, twice a month. And then the other opportunity is that we've been funded through a cooperative agreement to lead a project to help state education and health departments work together to better support sexual health education, sexual health services, and fostering safe and supportive environments in schools. And we're working with a number of different state teams, but we have a new cohort starting. So if you are interested, if you are a state level health or education person and you think your state would like to form a team and get some technical assistance around forming an action plan, reach out to my colleague Dominique Paris and she can share more information about that. And this also includes, there's some really great resources from Kaiser on thriving schools. They also partnered with the Alliance for a Healthier Generation to develop the RISE initiative, which focuses on staff wellness. So definitely check those out. This is also the link to the state health policy database. And we're 3 minutes over. Thanks so much for sticking with us. If you could, we're going to bring up a couple of poll questions just to get your feedback. So if you can stick around, please do, as my colleague brings up that poll. And finally, if there's any other topics that you would like to see a webinar on, just add that into the Q&A box and we will take a look at the topics that folks are interested in, particularly around supporting health in schools. So you should see something right now that says poll open, and if you could go ahead and click on that. But we appreciate your time, and I want to thank our panelists for their time and for their hard work throughout the year on this. That's why we asked them to join us today. So thank you so much for taking time to share your expertise with us.
Thank you for having us.
Thanks so much.
Take care. Thanks.
All right. Thank you, everyone. And I will stick around just a few more minutes as the polls come up. And again, put any topics you're interested in into the Q&A box.